If you're over 60 and you've been told your blood pressure is creeping up, you've probably wondered whether something in your daily routine is making it worse. And the honest answer is yes. But it's not one dramatic secret habit. It's usually a combination of a few ordinary, everyday patterns that quietly push blood pressure in the wrong direction. Today we're going to talk about exactly what those patterns are, what the research actually says about each one, and what small changes could realistically make a measurable difference. Before we dive in, I want to be clear that this is educational content. It's not medical advice, and it's not a substitute for conversations with your own doctor or healthcare provider. Everyone's health situation is different, and the recommendations we'll discuss may need to be adjusted based on your personal medical history, your medications, and any conditions you're already managing. Please use this as a starting point for better conversations with your care team, not as a replacement for them. So let's start with the big picture. We're going to look at 4 well-studied daily habits: prolonged sitting, high sodium intake, regular alcohol consumption, and poor sleep, and examine how each one influences blood pressure specifically in people over 60. We'll look at the strength of the evidence, what the numbers actually suggest, and we'll be honest about what we don't yet know with certainty. By the end of this, you should have a clearer, more nuanced understanding of how your daily choices interact with your cardiovascular health as you get older. To understand why these habits matter more after 60 than they did at 40, we need to talk briefly about what happens to the cardiovascular system as we age. These are normal biological changes, but understanding them helps explain why the same habits that were relatively harmless at a younger age can have a more pronounced effect on blood pressure in your 60s, 70s, and beyond. Blood pressure has 2 numbers. The top number is called systolic pressure, and it measures the force your heart exerts when it beats and pushes blood into your arteries. The bottom number is diastolic pressure, and it measures the pressure between beats when your heart is resting. A reading of 120/80 is generally considered normal. A reading of 140/90 or higher is where most clinical guidelines define hypertension in older adults. Here's what changes with age. Your arteries gradually become stiffer. When arteries are young and flexible, they absorb the force of each heartbeat like a rubber tube stretching and rebounding. As elasticity decreases over decades, the walls resist that stretch, and the pressure inside the system goes up. This is why systolic blood pressure, that top number, tends to rise steadily with age, even in otherwise healthy people. At the same time, your kidneys become less efficient at filtering and excreting sodium. Sodium plays a central role in regulating fluid balance in the body. When sodium accumulates, the body retains more water to dilute it, which increases blood volume, and more blood volume means higher pressure inside the arteries. Older kidneys are less adaptable, which is why sodium sensitivity, meaning how much your blood pressure responds to changes in salt intake, tends to increase significantly after 60. There's also a system called the autonomic nervous system, which continuously monitors and adjusts your blood pressure in real time. One key mechanism is called the baroreflex. Think of it like a thermostat for blood pressure that detects when pressure rises or falls and triggers compensatory responses. With age, the sensitivity of this system declines. The feedback loop becomes slower and less precise, meaning blood pressure becomes more variable and more reactive to the daily habits we're about to discuss. A younger body might compensate for a high sodium meal or a poor night's sleep more quickly. An older cardiovascular system may respond more strongly and recover more slowly. But that sensitivity works both ways. Positive changes in daily habits can also produce meaningful effects. Let's start with sedentary behavior, meaning sitting or lying still for long periods during the day. Modern life, especially for retired adults, involves an extraordinary amount of sitting. Researchers began using accelerometers, small wearable devices that objectively measure movement, to get accurate pictures of how active people are throughout the day. Multiple accelerometer-based studies published between 2019 and 2022, some involving more than 5,000 older adults, explored the relationship between daily sitting time and blood pressure. The REGARD study, a large, diverse US cohort, also contributed important data here. The consistent finding is that replacing about 30 minutes of sitting per day with even light activity, not vigorous exercise, just gentle walking or movement, is associated with roughly a 2 to 4 millimeter mercury reduction in systolic blood pressure. That might not sound dramatic, but at a population level, it translates to fewer strokes and heart attacks. And for someone already borderline hypertensive, a few points without medication is genuinely meaningful. It's important to be honest about the quality of this evidence. These are predominantly observational studies, meaning they track habits and outcomes over time, but can't fully control for every confounding variable. The associations are consistent across multiple study designs and populations, which adds credibility, but the evidence is rated moderate rather than definitive. Now let's talk about sodium, where the evidence gets considerably stronger. The relationship between salt intake and blood pressure is one of the most thoroughly studied topics in cardiovascular medicine. Cochrane reviews, systematic analyses of the highest quality evidence available, have pooled results from dozens of randomized controlled trials and found that reducing sodium intake by approximately 1,000 milligrams per day leads to a reduction of roughly 5 to 6 millimeters of mercury in systolic blood pressure in adults over 60. In people who already have hypertension, the effect tends to be even larger. The World Health Organization and the ACC/AHA hypertension guidelines both cite this as one of the strongest lifestyle interventions available. To put 1,000 milligrams in perspective, the average American adult consumes 3,000 to 4,000 milligrams per day. The recommendation for older adults is around 1,500 to 2,000 milligrams. For most people, the issue isn't salt added at the table, it's what's already in food before it reaches your plate. Processed foods, canned soups, bread, deli meats, condiments, and restaurant meals are the dominant sources. A single can of soup can contain close to 1,000 milligrams. A fast food meal can easily hit 2,000. Salt sensitivity also varies. Older adults are generally more salt sensitive than younger people, and sensitivity tends to be higher in people with obesity, kidney disease, diabetes, or in some ethnic groups, including African Americans. If you have any of these risk factors, the effect of reducing sodium may be even more pronounced. One caution: if you take diuretics or have kidney disease, discuss dietary sodium changes with your clinician before making significant adjustments, as the effects on your body chemistry can be more complex. Now let's talk about alcohol. Systematic reviews, including a major Lancet public health analysis, drawing on cohort studies and intervention trials with well over 10,000 participants, found a consistent dose-response relationship. As daily alcohol intake goes up, blood pressure tends to go up with it. The estimate is roughly 1 millimeter of mercury rise in systolic pressure for each additional standard drink per day. Intervention studies show that reducing from 2 or more drinks per day to 1 or fewer can lower systolic blood pressure by approximately 4 to 5 millimeters. The evidence here is rated moderate to strong. A standard drink in the US is 14 grams of pure alcohol, about 12 ounces of regular beer, 5 ounces of wine, or 1.5 ounces of spirits. When people pour their own drinks at home, portions are frequently larger than this, so actual consumption is often higher than people realize. For older adults specifically, alcohol interacts with many common medications, including blood pressure drugs, anticoagulants, and sleep aids. The liver also processes alcohol more slowly with age, meaning the same amount has a stronger and longer-lasting effect. And alcohol increases fall risk, which is already a serious concern after 60. Current guidance from most major health organizations is no more than 1 standard drink per day if you choose to drink, with the acknowledgement that less is better, and that for many older adults on multiple medications, avoiding alcohol altogether is the safest approach. Now let's turn to sleep, which is perhaps the most underappreciated factor on this list. Large prospective cohort studies have found that adults sleeping less than 6 hours per night have approximately 20 to 30% higher odds of developing hypertension compared to those sleeping 7 to 8 hours. Given that 60 to 70% of adults over 60 already have high blood pressure, that increase in odds is not trivial. There's also a specific condition worth highlighting: obstructive sleep apnea. This is a disorder where the airway periodically collapses during sleep, causing brief interruptions in breathing that can happen dozens or even hundreds of times per night. The person often doesn't fully wake up or remember waking, but the brain and body are repeatedly jolted out of deep sleep. Each episode triggers a stress response, including adrenaline surges and blood pressure spikes. Over time, this repeated overnight stress contributes to sustained hypertension. Sleep apnea is notably more common after 60 and substantially underdiagnosed. Warning signs include loud frequent snoring, gasping or choking sounds reported by a partner, waking with headaches, and significant daytime sleepiness despite adequate time in bed. Randomized controlled trials of CPAP therapy, continuous positive airway pressure, a device that keeps the airway open during sleep, show that treating sleep apnea can lower systolic blood pressure by approximately 2 to 7 millimeters of mercury. Consistent use is essential. The benefit depends on wearing the device most of the night on most nights. Before getting to practical guidance, let me address two common misconceptions. The first is that salt is the only thing that matters for blood pressure. The research doesn't support this. While sodium reduction has the strongest evidence, the effects of inactivity, alcohol, and poor sleep are real and additive. Addressing all four areas, even modestly, can produce a combined effect substantially larger than any single change. The second misconception is that lifestyle changes stop being effective after 60. This is not what the evidence shows. Many studies demonstrate that older adults achieve blood pressure reductions from lifestyle interventions equal to or sometimes larger than younger adults. The idea that it's too late to make a difference is simply not accurate. Now for practical guidance. For sedentary time, the goal is simple. Interrupt long periods of sitting every 30 to 60 minutes with 5 to 10 minutes of light movement. A short walk, standing up and moving around the house, gentle stretching. You don't need a gym. Setting a phone reminder, using a commercial break as a cue, or placing something you use regularly somewhere that requires you to stand up can make this habit easy to sustain. If you have balance concerns, use stable supports when getting up and don't rush. For sodium, the most impactful starting point is reading food labels and becoming aware of how much sodium is already in packaged foods. Cooking at home more frequently naturally reduces intake because you control the ingredients. Experimenting with herbs, spices, and citrus can make lower sodium cooking genuinely satisfying. When eating out, asking for sauces on the side and being aware that restaurant portions tend to be very high in sodium are useful habits. Gradual reduction is usually more sustainable than an immediate dramatic cut. For alcohol, if your current intake is 2 or more drinks per day, research suggests reducing toward 1 or fewer is likely to produce a measurable blood pressure benefit within weeks to months. If you find it difficult to reduce on your own, that's worth a candid conversation with your doctor. Effective supports are available. And if you take regular prescriptions, ask your pharmacist about alcohol interactions, because these are more common than many people realize. For sleep, if you're not getting close to 7 to 8 hours most nights, start with sleep hygiene basics. Consistent bedtimes and wake times, limiting screens before bed, keeping the bedroom cool and dark, avoiding caffeine late in the day. If you experience symptoms of sleep apnea, loud snoring, gasping during sleep, morning headaches, or significant daytime sleepiness, raise this with your doctor. A sleep study can diagnose it, and treatment can produce real cardiovascular benefits. You don't need to tackle everything at once. Picking one area where you have the most room for improvement and starting there is completely reasonable. Monitoring your blood pressure regularly at home with a validated device can give you useful feedback on whether the changes you're making are actually having an effect for you specifically, rather than relying entirely on population averages. Now, when do these lifestyle conversations need to accompany medical care? If your blood pressure readings are consistently at or above 140/90, that warrants a proper medical evaluation. Lifestyle changes are often tried first or alongside medication, but you should be having an active conversation with your healthcare provider rather than hoping the problem resolves on its own. Seek prompt attention if you experience severe, unusual headaches, vision changes, shortness of breath, chest pain, or sudden weakness or numbness. These can signal serious cardiovascular events requiring evaluation, not a lifestyle tweak. And if you've been prescribed blood pressure medication, please don't stop or reduce it based on lifestyle changes without discussing this with your physician first. Medication adjustments, when appropriate, need to be supervised with careful monitoring. Let's bring this together. After 60, blood pressure becomes more sensitive to everyday habits because of changes in arterial stiffness, kidney function, and autonomic regulation. 4 well-studied habits consistently linked to higher blood pressure: too much sitting, high sodium intake, regular alcohol consumption above moderate levels, and insufficient or fragmented sleep. Sodium reduction has the strongest evidence: 5 to 6 millimeter systolic reductions from cutting about 1,000 milligrams per day. Alcohol moderation has moderate to strong evidence with 4 to 5 millimeter reductions from cutting back. Breaking up prolonged sitting shows 2 to 4 millimeter associations from light activity. Sleep improvements, including treating sleep apnea, have moderate evidence for meaningful reductions. These effects are cumulative, individual responses vary, and medical monitoring remains an essential partner to lifestyle efforts. If you found this useful, please like the video and subscribe. It genuinely helps us reach more people looking for evidence-based health information without the hype. Leave a comment if you have questions or topics you'd like us to cover next. The information in this video draws on Cochrane reviews on sodium reduction, WHO sodium guidelines, the ACC/AHA hypertension guidelines, the Regards cohort study, accelerometer studies from JAMA Network Open, the Lancet Public Health alcohol meta-analysis, and clinical evidence from the Sleep Journal, the American Academy of Sleep Medicine, and CPAP trials published in the New England Journal of Medicine and Hypertension Journal. All peer-reviewed, all representing current mainstream scientific consensus. This is educational content, not personalized medical advice. Use what you've learned today to have more informed conversations with your own healthcare provider. That's exactly the kind of engagement that makes a real difference in long-term cardiovascular health. Take care of yourselves, and we'll see you in the next one.